So you're on a scene and you're assessing a patient. You roll him over and all of a sudden, lo and behold, there's a holstered gun in the small of his back. What are we going to do now? That's what we're going to talk about in this episode of Escaping Violent Encounters. I'm Kip Teitsort. Welcome to Escaping Violent Encounters. With more and more states having concealed carry permit holders, it's more and more likely that you're going to run across someone who's got a holstered weapon. While this may initially throw you into a, whoa, this isn't my normal routine, it doesn't have to be the end-all be-all and break your call into a hazardous type of a scene or situation, because the concealed carry permit holder are lawful abiding citizens, but they may be ill or injured, requiring our assistance. So there have been reports of a gun being found in the helicopter when it fell off of a patient. There have been reports of the gun wasn't found until the person ended up in the ED or at the trauma center. So it doesn't always mean that just because a gun is present that the person wants to hurt us. Let's talk about a few things we can do to control that the best that we can. The best advice I can give you right off the bat, if it's holstered and it's not interfering with patient care, leave it alone. The next best thing is, if your patient is lucid enough and they can remove it themselves and maybe hand it off to a family member, because again, this person is a patient and not an aggressor, hey, let them do that. They're familiar with their firearm. Next, you may ask an officer, if you've located a firearm on a patient, if the officer would secure that, because as a general rule, many officers have more experience handling a firearm than we do. And lastly, if you have to touch the firearm, leave it in the holster. Remove the entire holster and the firearm itself. It's not our place to attempt to clear a firearm and make it safe on a scene. If you haven't trained with that, we've all heard those stories of people accidentally getting shot with unloaded firearms. So touching someone else's that doesn't belong to us, just like any other rule, is something that we shouldn't do. So if you're left with no other choice but to remove the firearm due to a patient care type of a scenario, do your best to remove it with the holster and do so safely. Secure it, notify your supervisors, and document it. Keep these steps in mind. If you don't have to touch the firearm, don't touch it. If the patient is able and they're stable, let them remove that holstered weapon and maybe pass it off to their family members. If that's not able to happen, how about ask an officer to secure that holstered weapon? And finally, if patient care is compromised and you have no other choice, remove the holstered weapon, secure it, notify your admin, and document the fact that you've done so. I'm Kip Teitsort, and remember, your safety comes first.